that and take it away. The floor is yours.
Thank you all for asking me, and I'll keep this informal. I want to go through this and not belabor it, but if you have a question, write it down and we'll get to the end. I'll try to answer all the questions that you might have. So this is this first slide is kind of the main one.
The air you breathe is 5 times more important to your health. All treatment rendered by hospitals, doctors, and medication. The air you breathe is 2 times more important to your health than your genetic code. That's extremely powerful because if you fix your air, it's twice as effective as fixing your genetic code with no side effects. Nearly 60% of all preventable deaths are due to the condition of the air at home and at work. You breathe 1,080 gallons of air per day, so no treatment can overcome that much volume. The air must be clean in order for you to get well.
All right, so I'm going to switch back and forth from the mics to the videos here. Okay. So the CDC had Mold Awareness Week of August in 2019. They said that all chronic illnesses should get mold as a cause off the table, which was a big breakthrough for them because they were about 20 years behind. And so what we do in the office, we have SDA auger plates and we do tap testing on the clothes of every patient. So the criteria to tap test a patient is that they have a pulse. So we just tap test everybody, just like you'd take a blood pressure and a temp and a pulse ox, we tap them all. So we're trying to figure out if their environment is a problem with whatever's wrong with them. So we send it to Immunolytics lab. There are other labs that do it, but the colony count's got to be 0 to 4 for them to be normal. Sometimes you have, 40 or 50, and that problem, that patient has got a severe environmental problem. And when you do a questionnaire, we pay attention to the way they smell. Some people can smell it, some can't, but some genus molds have a specific smell, and you can kind of tell what's wrong with them. And we did urine mycotoxin levels and fungal serum IgG levels. And then we have 2 websites. One's educational and one's for products. So so the 3 key factors here: the air you breathe is 5x more important to your health than all treatment rendered by hospitals, doctors, or medication. And the air is 2x more important to your health than your genetic code. And nearly 60% of all preventable deaths are due to the air conditions at home and at work. This is the genus of the common fungi and what mycotoxin they make. So you don't need to belabor that, but you sort of get used to which ones make which toxins and what the toxins do. So this is important because Dennis Hooper is the guy that has real-time labs. He's a pathologist, and he started this study with the urine mycotoxins. So he went to the pathology lab and got all the cancers they had in the lab, and he did 31 cancers: isotoma, brain, breast, and mesothelioma, and all 87% of those biopsy specimens that were positive for cancer had mycotoxins in the tissue that are known to be carcinogenic. So it's certainly a major cause of malignancy in this country, and it's overlooked by most people, I think. So that's really important to remember. So we have environmental requirements. We have over several thousand patients. We figured out what they need to have. They need a HEPA filtration. Intellipure is a name of a good HEPA. and a central dehumidification system. That's really important, especially in the South. You have to put the dehumidifier in there and take the warm, dry air and put it across the coil. Instead of the way the manual says to do it is to enter it on the supply side, so you bypass the coil. What you're trying to do is keep the coil dry in the summer so you don't grow mold in the coil. And bipolar ionization is really important. Now, there are lots of people that do bipolar ionization, but most of them have either ozone or hydroxyl groups, so it has an odor. So if it's got an odor, you don't want that. So this one called Ultimatum will produce, it's about 350 million ions a second. They're positive and negative. And what they're doing is it's breaking the water in the air, H2O, to an oxygen and hydrogen. And those remove molds, bacteria, viruses, VOCs, and mycotoxins. So this little machine here will fill a 20 by 40 room by 8-foot room. So that many square feet in 2 minutes, and replace it every 2 minutes, so that the degeneration time for the ion doesn't exceed the supply side. So the air is packed with these things all the time in a room that size. So that's the air they breathe, not the contents. But if at least you can get these people clean air, they can start getting better until they either fix their house, whatever's wrong with it, or get out of there and not take anything with them. Now, we're talking about really sick people. If you have a lot of neurological symptoms, it's probably best to leave and take some of these ultimatums with you and fix the house from afar, and then re-enter the house after it's been done and see how you feel. And if you don't feel well, then you really need to stay out of there. That's really probably the take-home message for this whole talk. So central air filter, this is a HEPA, this is April Air. It's close to a HEPA, and that's probably the least expensive thing to be as close to HEPA as possible, and it's electrostatic. And you can't have any fiberglass in the airstream. Fiberglass is like cotton candy for fungus. So many duct systems are allowed with fiberglass, and these people cannot have fiberglass in their airstream at all. So, the airborne is a soup of mold spores, mycotoxins, and MVOCs. They enter through the nose into the sinuses, brain, lungs, and entire system. Sinus mucosa has the highest concentration, so there's no long-term wellness from chronic disease without clean air, water, and diet. So focus on the clean air, and we use a yeast diet. The thing is, all the fungi have the same cell wall structure. It's basically a 1,3-beta-glucan. So if you're breathing it in the air and your gut's full of yeast, you get a cross reaction. So then you start reacting to your own gut yeast. You get gut inflammation and food allergies, and on and on and on. So you've got to address the diet and the air to get these people totally well. So you can't have any chlorine in the air, in the water, because the chlorine does not kill fungus, but it kills everything else, so the fungus overgrows. So like in restaurants, sometimes they don't change their filters, and you'll get chlorinated water. So you want to stay away from that. So this is a diagram to show the olfactory nerve takes all the toxins directly into the brain, but they also enter the brain from the ethmoid sinuses and the sphenoid sinus, where they get to the pituitary. And all these people have some degree of pituitary exposure, but all of them don't have hormone defects. But if they've got an energy level of 50 or less with 100 being normal, then 53% of them are growth hormone deficient when you test them if they see if they can make growth hormone. So if they're missing growth hormone and they can't make it, and they're tested and stimulated to show they cannot make growth hormone, if they don't get growth hormone, you virtually never can get them well, because they can't make new cells. So that's really important to get that off the table. So this is the definition of clean air. So you have a particle count at 0.3 microns of less than 50,000 per tenth of a cubic foot. There are instruments that measure this, and we're working on trying to get an instrument that will do both particle count and VOC level in one thing, and then have it'll be green, yellow, and red. Green is okay, yellow is caution, and red would be run. So that it's okay for 100% of the population, not 80%. So 80% can be in a bad environment and they don't have much symptoms, but 20% cannot do that. So the number needs to fit the whole population, not 80% of them. And as it does, when you get these people to test, all the testers that do mold testing, the testing is fine, but the conclusions of what is a normal level for human health are totally made up. There's no medical data to support it, and they're too high for these really sick patients. So this is a real number here. And the colony counts, this is why I like to do colony counts, to me is more accurate for what you're trying to do. You do 0 to 4 colonies with a 1 hour plate exposure for most people, but if they're severely ill, it needs to be 0 to 2. Now, this is an important slide because this drives the point in that the way to get anybody well is to remove the antigen that's causing the problem. So this picture on the left up here, this white thing is a fungus ball in the sinuses. And all this stuff in here is polyps and fungus. All this is supposed to be black for anybody who doesn't know that. And so this patient was 23 years old, and she had a heart transplant at age 3 months. And this is the best she got with 4 years of intense dermatology treatment, orally and topically. So she had eczema, and this is the best she got. Now, once we clean this out and irrigated all the sinuses out with a cyclone using either amphotericin or voriconazole, the cyclone is like a mini pressure washer with a suction on it. So none of the material goes anywhere. All the toxins are suctioned away. So after this surgery was completed, 6 days later, her legs look like this. Now, nobody's going to believe that unless you saw it. But this goes to this in 6 days after you get rid of the cause of the problem. This is an immune reaction to fungus in her nose, and it's systemic. Isn't that amazing? So, I mean, and this is her hands, and this is her face. So this is a piece of mucosa taken from her ethmoid sinus, this dark brown thing. And the brown halo around it is the mycotoxin, which is ochratoxin A and mycophenolic acid, in her case, leaching out of the tissue. So you can actually see the mycotoxin leaching out of the tissue. And that's what was causing the brain issues and the immune issues in the skin and the energy level, and also the hormone deficits. This is to show it doesn't matter what a place looks like. This place looks fine, but this place right here has the same fungus count as this place over here. So the plates are the same. 2 numbers to count in both of those. So you can't tell by looking at it, but a lot of times you can tell by smell. If it smells a little musty, it's mold. So if you can smell it or see it, it's too high for human health is the basic rule of thumb. And you can have rooms where you can't do either one of those, and it can be toxic. So this is the immune system. This is a diagram showing what happens in the sinuses. This is a genetic defect, and it shows the genes that are involved. You know, if you know anything about the genes, TUB3, 5.1, and all that. It's a defect in one or more of 9 chromosomes. It's a T-cell receptor defect at the beta variable site. So let's just say this is the beta variable site. So the antigen is supposed to dock in here, but instead it docks on the side of the molecule. And when it does that, you get a reaction, normally 0.0% of the total body's T cells. but it activates 30% of the total T cell population in these people with this genetic defect. So you get 3,000 times more T cell activation, and each one of those T cells or eosinophils is releasing 3 inflammatory mediators: interleukin 5, interleukin 13, and interferon gamma. So now you got 3,000 times 3. So you got 9,000 times the systemic inflammation per mole spore. So that's why they can't tolerate it. That's why if you don't get the air right, nobody's going to ever get better. So this is another, this line here is the mucosa, represents the mucosa inside the nose. And these things represent fungi. And then so the fungi come in and sit on the mucosa. Then eosinophils come in to destroy them. And in doing that, they rupture and release major basic protein to kill the fungus. And when they do that, they destroy the cilia and they etch a pit in the lining, and that pit gets full of mucus. And then it gets multiple bacterial infections, strep, staph, a lot of staph in there. And so then most people treat them with antibiotics or topical sprays and all. And that's helpful for about 10 minutes. But then it just keeps coming back because they haven't removed the cause, which is the fungus. So you got to remove the fungus in order to get this well long-term. No one has ever cured chronic sinusitis with antibiotics for any length of time you can think of. It never happened, and it never will happen. You have to get rid of the source, which is the fungus. So then the fungus goes down in the tissue, and this is a picture of it docking, the eosinophils docking with the fungus. And this is a picture of the eosinophils releasing the interleukin 5, 13, and interferon gamma, and the B cells release interleukin 13, which make more IgG fungi, IgG antibodies to fungi. Now, that's why if you do the blood test on these people, do IgG fungal test, almost all of them are positive because it just keeps churning out IgG antibodies. Now, this is what the inside endoscopic exam inside the sinus looks like for people who have fiberglass or particulate in the airstream. So this is a visual of what eosinophil infiltration looks like for every spot where a fiberglass particle hit. So you couldn't see the particle, but when it hits, the eosinophils come in, and they're doing that reaction that you just saw right now inside the sinuses. And this is really bad in here. So this person, you cannot get this person well no matter what you do unless you fix their air, because they're breathing. The number is actually 3,000 gallons instead of 1,800. And so you can't beat that kind of volume with any medication or surgery or irrigation or whatever you want to call it. So this is a picture of the fiberglass particles. This is just what you can see, but there are many that you can't see. So fiberglass should be, this should be outlawed, really. And it should be inside of plastic bags, and rolled out. And so John Manville Comfort Therm is the one that we like best. So it never gets airborne like this. This patient was about 45 years old. She was a dog trainer and all the dogs were dying. And so she got lung cancer, had one lung out and part of another lung, and her sinuses were all whited out. And it's because all the fungus inside this air system. So now this is an example you've heard of the membranes that go inside the biofilm. That's the new term, the biofilm. Everybody's heard of that. Well, this is a biofilm, but why do people have biofilms? To remember the pit in the lining. So the pit in the lining is the lab upon which a biofilm is built. So biofilms are composed of all kinds of bacteria, and you grow anything you can think of in there. This particular one is mostly candida. So there's no getting rid of a biofilm with any kind of spray or topical or oral medication. You have to get rid of the fungus that's causing the pit in the lining. If you get rid of the pit and the lining, you cure it long term. That's the point. So all we did, this was, we got the air straightened out, and then we used amphotericin in here, and this is what it looks like afterwards. So this is all this white stuff is candida, and this is cleaned up, but it's cleaned up because the air was resolved. And this is the same idea. This is the counts in the air in that house, 48 colonies, and normally 0 to 4, that you get the colony count down, and then all this treatment works after you get the colony count down. So this is a fungus ball in the sphenoid sinus, and so anybody who doesn't know this, when you see a density inside a soft tissue mask, most of the time that means it's a fungus, because the fungi secrete calcium salts and metabolize food. So this is a big fungus ball in the sphenoid sinus, and the internal carotid artery is right over here, and the optic nerve's running through here too. So we can't leave all that stuff in here, or they get meningitis and a brain abscess. And so this is the rooms that it's just 2 nerves to count everywhere, and penicillin and aspergillus. So that's why she had this. So we clean all this out, and then we irrigate it with amphotericin, but we don't fix this over here. She's only well for 10 minutes, So in organized ear, nose, and throat, the common procedures do steroids, antibiotics, allergy shots, and surgery 5 million times, and it never works because you don't fix the air. If you breathe in 3,000 gallons of air a day and it's got this stuff in it, you're not going to ever get better. It makes sense, doesn't it? All right, so this is a fungus ball in the left sphenoid sinus here. And this is what it looks like on the lateral view. And see, she's got a little breach here in the base of the skull, so she's set up for meningitis. This particular person couldn't take any azoles like itraconazole or voriconazole, any of that. She couldn't have any of those. And she had a big mass in her lungs, and the pulmonologist couldn't do anything with her. And so she was kind of going to be deceased in a few weeks. So she came to me, and we found this was seeding her lungs, basically. And so we cleaned all this out, got her house fixed up. And then for the amphotericin, they were afraid to give it IV, because of knocking out the kidneys. And so the pulmonologist was a great guy. He graduated from Harvard, and he actually listened. So I told him to bronchoscope this woman and irrigate each bronchi with amphotericin with a steroid in there, and it would make the fungus would release if you put amphotericin on it. And he did that, and then put it on amphotericin embolization, and all the lungs cleared up, and then she's fine. She cleared up in about 2 weeks. So this is to show you what putting amphotericin in the sinus. This patient had sinus surgery, so she has a big opening here. And she was on an airplane and got mold exposure, and they got cognitive dysfunction. This is what she says.
This is patient Stanley, who's vertigo and cognitive dysfunction. Can you tell me what happened to you?
I was on an airplane on Thursday, flying 2 times that day, and later that night, early the next morning, started feeling dizzy, vertigo, fuzzy head, impact on my sinuses.
And then what happened to clear it up?
For today, when you did this procedure
With amphotericin into the sinus.
it immediately cleared my head. No more vertigo, no more fuzzy thinking. My sinuses opened immediately.
Thank you.
Okay, so, and this is what it looks like to put this is an endoscopic. This is an endoscopic. Now, if anybody can't hear, tell me, because I can turn this thing up. We just squirt amphotericin in the sinus. This has already had surgery, so this big hole is because of surgery. You can't do that on a normal person unless you stick a needle through there. Okay, so now this is important because it's acute EEG is a scan that you do electronically. This is the voltage in the brain. So red is high voltage, disorganized thought processes and cognitive dysfunction. So this patient had all red in here. And after we got the fungus out of the, we irrigated the nose, and then we gave him nebulization of amphotericin in the office, and then we get the brain changes to this, which is normal, just by killing off the fungus. Now that won't last but about 2 hours until you really clean it out of the nose endoscopically and fix the air, but it's just a preview of what it does. So this is changes from cognitive dysfunction, like she was describing, and vertigo and all these other symptoms to normal. This is important because this calls a P300. This is an audiometric test. It tells how much time it takes for the sound to get from the eardrum to the brain. So normal is 300 milliseconds. So this line over here to the left is when the noise occurs. That's the input noise. And where the lines cross is when the brain hears it. So this person is up here. It says NR, no response. So this brain never heard what you just said. So on these really toxic mold patients, you got to get them to write everything down. We give them a pad and tell them what to write, because if your mouth's moving, nothing's happening, because they're on word 1 when you're on word 4. And then this one, normal is 300 milliseconds, but this was like 461 milliseconds in order to hear. So hearing's delayed. I knew that was true, so I got all these tests done to prove that they were impaired cognitively because the hearing was delayed. So this is another picture of this is ethmoid mucosa from the sinus, and this brown halo, in this case, is 1.2 parts per billion of trichothecene. So we tested this tissue, and we know this brown halo is really trichothecene. So this is what it looks like on the CT scan. See that little white spot in there is the calcium discharged by the fungus when they're metabolizing food. And so that's how you know it's a fungus in there. And it doesn't happen that way all the time, but basically you can't see mycotoxin. So all this stuff over here, can you see my pointer? Can anybody see my pointer?
Yes.
Yes, we have it.
Okay, so we're looking at any mucosal edema. That's a sign of inflammation. So this doesn't have a white spot, but this is fungus in there too, and mycotoxins. So all this is abnormal. See, right here is normal. This is not normal. This is not normal, and this is not normal. So most people don't look at it that critically, but we're looking for signs of inflammation caused by MVOCs, work, and mycotoxins. So this is an example of a control. This is a piece of tissue that doesn't have a brown halo because it doesn't have any trichothecenes in it. So this is an example of trichothecenes again, what they look like when you put them on. This happens in about 4 days after you put it on the plate. And this patient didn't want her picture taken. So this is what she has to say. This is the cyclone, excuse me. This is the instrument we use to clean it out. And it has a suction with it too. So the toxins doesn't go anywhere. It sucks it right out. And the next one will show you how fast it sucks on a tube. That's pretty impressive. So all those toxins go out. And this is why it works. It goes 360, and it's very powerful, and it sucks at the same time. So without that device, with normal irrigation, standard irrigation, the results are about 30% of what you get with this thing. So, and this is what it looks like in the surgery room. Okay, so this is just a picture before and after. This is about 6 weeks after surgery. This patient, massive difference in the way they look. This is really a sick patient, and this all the toxins are gone. And this guy had hearing loss for 10 years in the left ear and tinnitus. And in the recovery room, he's shouting out he can hear again. So it's kind of unbelievable. So I had to record that. So this is what he says.
So I would guess that I've been brought out of anesthesia for about 20 minutes now. The first thing I noticed as I came to is my hearing has improved drastically. I can hear the conversations in the room next to me. I'm still trying to determine if the tinnitus is completely gone or just mostly gone. The ringing is obsolete in my ears. I haven't been able to hear this well for at least 10 years. Okay, so this is the stuff we got of his sinus. This ethmoid sinus. This is ethmoid sinus mucosa, and this is he had 4 different toxins in that tissue. So this was assayed and to show what he had. So this is what the CT looks like. Most people wouldn't say this is a little swelling. There's nothing there. But you see, it's got diffuse swelling here, and this was actually full of mycotoxins. So this means something. So we cleaned all this out and irrigated him, and then that's the result. That's in the recovery room. That's really unusual. I would bet that was impossible to happen if I hadn't seen that happen. Now, this is the patient. This is her sinus. She has 2 major toxins leaching out of her mucosa here. You can see it right here. And this is what her CT looks like. It's not too bad, you know, it looks pretty decent. But look what happened to her. She had severe anxiety, depression. Severe depression. And she, I'll just let her say it.
My symptoms were suicidal depression as well as anxiety. My treatment was numerous SSRIs, tricyclic antidepressants, as well as SNRIs. I also received just under 20 electroconvulsive therapies to my brain to help to treat depression. I also was institutionalized for my condition, and I was considered to be treatment resistant. I recently just had sinus surgery with Dr. Dennis, and it has completely revolutionized my psychiatric condition. I am no longer experiencing any depression, nor am I experiencing the extreme anxiety. I feel as if he has saved my life, and I am no longer on any psychiatric meds. It is a complete miracle. Thank you, Dr. Dennis.
So that's life-changing. So that's why we do this work. But when she came to me, she was from Canada, and the first thing she said when she was in the chair says, "I'm going to kill myself." She had 3 little kids. And I said, "Well, don't do that yet. Let's just see what we can do first." And so this happened. I never thought that this was possible. Then we got pictures of her brain QEEGs, and you could see the damage she had, and you could see the damage improving. So, so this is more of the same stuff, just to show you. Aflatoxin is the brown halo. It can be any toxin, but it leaches out and makes a brown halo. All right, so this is the pituitary. If you have a fatigue, energy level where you're 5 and normal is 10, you got a 53% chance you got growth hormone deficiency. So most of all of these patients in the study that we did had normal resting levels of IGF-1, so they would have never gotten worked up. So of the ones we tested for growth hormone, 51% were deficient who had normal resting levels of IGF-1. And so if they hadn't gotten injectable growth hormone, they would have had rapid degeneration, accelerated aging, and they would have never gotten better because they can't make new cells. So it's a combination. Most commonly, it's going to be thyroid and then ACTH, cortisol. So prolactin's elevated. I'm going to show you some other pictures later, but prolactin's elevated, and a certain percentage of these do have pituitary tumors. And we have seen that the prolactin drops after sinus surgery, but the sinus surgery does not get rid of the tumor. And a lot of those people have to have surgery. So we've got a group of 3 who are getting surgery. One of us already had it, and the other 2 in the next several months. And we're taking that pituitary gland, and I'll show you this later, but we can see through artificial intelligence, we can see the mycotoxins in the brain, and we're going to see if mycotoxin we're seeing in the brain is truly in the pituitary and maybe a causation of the tumor. So we'll get to that in a minute. But anyway, this is the important to really work up everybody, work up the pituitary automatically, get all the hormone levels, and get a good endocrinologist that'll test these people and challenge their to make growth hormone, even when they have normal levels. Because we had over 400 of them, and almost all of them had normal range, and so they would have never gotten worked up. So in organized endocrinology, they think it's like in their whole career, they see maybe 15 or 20, and it's the incidence is 1 in 10,000, finding 6,000 new ones a year in their world. But the real incidence is it's over 5 million of them in this country, and it's probably more than that. So it is the single most common cause of human growth hormone deficiency. It's in the literature now with just this one paper, but the organized endocrinology doesn't know this yet. And so just know that they need to be worked up if they have fungal load. So,
Dr. Dennis, are you doing a growth hormone stimulation test or just the growth hormone, TSH, ACTH, like you have listed here?
Well, I don't do the growth hormone stimulation test. David Robinson is the guy that wrote the paper with me, and he's an endocrinologist. So he'll do the old insulin tolerance test and glucagon stimulation test. You could actually use Somorlin's available now. You could use Somorlin, which would be more natural, but you've got to stimulate them, see if they can make it. And 53% can't make it if their energy levels are 5 or less. So, and it's higher than that as your energy gets lower and lower. So that you got to get an endocrinologist to do that test. You got to have the test in order for insurance to pay for the growth hormone. So that's really important. Now, so this is the IGF-1 average was 123, and 40 out of 79 were deficient. Look what the normal levels were. Normal was 88 to 249. And the range was, there's a 285 that was growth hormone deficient. Think about that. Nobody really worked the 285 guy up, right? But the 285, it just tells you IGF-1 is not a really accurate measure of what growth hormone is really doing. But this person couldn't make growth hormone when stimulated, so they needed to have it. So 51% had growth hormone deficiency. And if the IGF-1, this is how you can tell. If it's below the 50th percentile, most are growth hormone deficient. So just get the normals, do an average of them, and then see if they're below that average, they probably have it. That's the easiest way to do it. But you can do this too. You can give them this orally and then see if you can make their IGF-1 go up, over time. And if it doesn't, they're likely to be growth hormone deficient. But they still have to have a authorized test to get paid for. We use oral Somorlin a lot. It just drops under the tongue. It works great for people whose pituitary can work. Okay, so this is a guy who was diagnosed as Parkinsonism, And we operated on him and cleaned everything out. This is what he used to look like before.
Baker 6/25/15. Left tremor of the arm and some leg tremor as well.
Okay, so this is what he looks like after we operate on him. This is after treatment of mycotoxicosis. So it's a pretty good difference. It is better than taking all those pills for Parkinson's, right? So now this is an older one before he had good cameras. This guy was in North Carolina. He's a famous gospel singer, and he literally was in a wheelchair for 2 years. He couldn't stand up. So, and he did everything he could do to his house, and he was on everything you can think of. He went to Bill Ray's and everything. And it ended up that he could not either do the outdoor environment or the indoor environment in that location because he got hypersensitized. So when this guy, we were going to give him shots for aspergillus because that was his worst. So we did I don't know if anybody does allergy shots in this group, but we gave him a -12 dilution. So I think everybody knows what that is. So you know, bottle 1 is 1 cc of aspergillus and 4 cc's of saline, and bottle 2 is 1 cc of bottle 1, and so on, up to 12 dilutions. That's almost a drop in the ocean. And so we did a tiny bit intradermally on this guy, and he had anaphylaxis. So we reversed him with epinephrine, and then after that, he went into anaphylaxis again, and I couldn't give him any more epinephrine, or I killed him. So I just quickly excised the little wheel that I'd made in his arm, and he was okay in about 2 minutes. Antigen removal is pretty powerful. So without me taking it, removing it, I couldn't have saved him. So that's just a lesson learned. Anyway, this is his story.
This is Tim Green, fibromyalgia, muscle weakness. Now go backwards. And it's fitness care. Okay, so this is what he looks like about 6 weeks or so later.
Hi, I'm Tim Green. I'm now living on the coast of North Carolina, and I'm living right here on the water, where there's no grass, no trees, just the breeze off the ocean, and I'm doing so much better. My health is tremendously better now because I'm living where there's a 0 mold count. That's made all the difference in the world in my health. I had severe headaches. I was in a wheelchair for over 2 years, living in the mountains of North Carolina where it rained all the time and there was mold and trees everywhere. But now living here where there's a 0 mold count, I'm healthy, I'm walking again, and praise God, life is good. Thank you, Dr. Dennis.
So this patient had a trailer. She had a trailer, and she had cat died in the trailer, and the cat got all the symptoms. She had blindness and legs wouldn't work. And so she had a paralyzed bladder, paralyzed left leg, blind right eye, and a paralyzed right eye as starters in that trailer. So this is what she looked like.
This is Jennifer Parrish, who had a severe mold exposure in a trailer and has trouble walking. She has paralyzed left leg and inability to evacuate her bladder or bowels. And she's had 3 episodes of this after living in a trailer where her cat died and got leg paralysis as well from the mycotoxins. Okay, this is what she looked like. This is about 6 or 8 weeks later. This is Jennifer Parrish on 11408. Patient had right eye paralysis and right eye blindness. Now she can look all the way to her nose, and she couldn't do that before. She had left leg paralysis. Stand up for me. She can walk easily. Go back that way. With her left leg, she can support her weight on the left leg. Lift up your right leg. Lift up your left leg. So she's got all her strength back. and her neurogenic bladder is over, so she can urinate properly, and she had a mass around her spine, which has gone away. This is all on Sporanox and vitamin supplementation, and her vision's coming back while they're chelating her for heavy metal.
Okay. All right, so this is a guy who lived in a moldy house, and he couldn't walk very well. So that's the best he can walk. That's it. He's almost paralyzed. All right, so this is about 6 or 8 weeks later. After he got out of the house, went to the beach, took all of his stuff, took his meds and antifungals, and this is what it looks like. All right, so the point of showing you these is that he's totally well, back to normal. Then the guy comes a month later to my office, gets to the airport and gets a moldy car and drives to my office in 30 minutes. In 30 minutes exposure to mold, he's almost like he was before. So that just tells you, if you get back in it, you get it right back again.
Tell me what happened to you.
This is a direct reflection of having mold exposure today. Last week, I had better movement of my hand and arm. I could extend my hand out and the arm out fully, which now I can barely do.
All right, so the point is, if you get in mold and you're already well, it doesn't take very long to get sick again. And that's just for life. And this person was a dental assistant, and she was in a bad dental office in a bad apartment. She had laryngeal vocal cord paralysis, very hoarse voice initially. And then we got rid of that problem.
This is patient exposure, got severe neurological symptoms with nerve pain, leg and muscle pain, dizziness, ringing in the ears, and cognitive dysfunction. From being in a moldy dentist office. And tell me what happened after you moved into the apartment.
After I left the dental office, I moved into a condo with new construction, and I could smell all the newness of it, all the paint and the wood and the plaster, and I didn't really realize that was a problem, and all my symptoms worsened.
So the point of that is, almost all these patients have cross-reactivity and chemical sensitivity. And the reason for that is, that initial cell diagram I showed you where the T cell receptor site's deformed. Well, once the fungus gets on that site and other things get on that site, it becomes deformed, and a lot of other things can sit on that site. So they get the same reaction to chemicals as they do to fungus. Is a cross-reactivity. So that's why you've got to get all that stuff out of the air for them, including the VOCs are just like mycotoxins in terms of what it does to her. So the body does the same immune reaction regardless of what it is.
I ended up in the emergency room a few times, severe pain in my nerves and muscles, dizziness, weakness. I would try to walk and I would fall. I was that weak. I was nerve pain, fingers, legs jumping uncontrollably. And I, for almost a year, I was bedridden, laying in bed, bedridden, sick, never leaving the condo. And I couldn't afford it anymore to live there. So I moved into Cumming with one of my friend's parents. And within probably 3 months of living there, my symptoms started to subside.
See, once you get out of it, you get better. Without getting out of it, you never get better because you're breathing too much air every minute.
I just started feeling better, clearness, the ringing in my ear was gone, the pain, the weakness, just the muscle weakness of walking around was going away.
And the hoarseness went away.
My voice was absolutely fine. I had no hoarseness. The voice that you hear now was absolutely gone.
Then you moved into a new condo and it rained and you got.
I moved into an old, I moved back to Buckhead into an old condo, and it rained for probably 5 or 6 days straight. And I could start smelling the mold and the mustiness in the condo. And I got a relapse where I couldn't get out of bed again. The hoarseness came back, the nerve pain, the ringing in the ears, the severe dizziness, and lack of being able to concentrate.
Okay. This is patient.
So when you get back in it, you get it right back again. So now this is research we're doing now. What we're doing is taking CT scans that we've done before in areas that we biopsied, and we know which mycotoxins are in that area. So the artificial intelligence software is able to take the digital data from satellites and run it through about 7,000 algorithms, and they can see enemy submarines under the water and locate the coordinates of where they are. So I had a friend of mine who's head of the company that does that. So I said, well, we'll just take all the mycotoxins and put them in vials, and we'll do CT and MRI scan the vials, and then we've got tissues that we've biopsied before, and we know the exact location where the positive mycotoxins were, and then see if we've got any matches there. So this is what artificial intelligence software, a test tube with gliotoxin. So that little black stuff in there is an oily substance, which is gliotoxin floating in the liquid. And when you look at the test tube, it looks like water. Doesn't look like anything's in it. And then this is the biopsy site here, where that little black thing is, which is positive for a gliotoxin. So this is the first time we knew this was going to be important. So this is the first time you can match a CT scan mucosa with a mycotoxin. So you can actually see a mycotoxin in there. And this is an example where this is an MRI scan, this pituitary here. And this is a test tube, an MRI scan of trichothecene. So that's the black substance in this test tube. And so the black stuff is in the thalamus of the brain, where all the sensory information comes in and distributes it where it's supposed to go. And you can see that this pituitary has got some of that in there, but this is responsible for some of the neurological symptoms these people have. And then this one is, okay, this thing right here is the test tube. The MRI scan would not register the test tube mass and thought nothing was there. So we would not shoot the test tube when we just set it there. So I had to tape it to my leg and stick my foot in there. And that's how we got this. This is my foot. That's how we got this picture. So this is what MRI scan. This guy had sinus surgery and he had severe headaches. The neurologist got an MRI and he found a colloid cyst in the left ventricle of the brain, which was causing his headaches. Then we ran the AI algorithms, and it turns out this is gliotoxin here. This is what gliotoxin looks like in that algorithm, and this algorithm matches the colloid cyst. So what happened is the body walled off this gliotoxin to protect the brain from the gliotoxin. It's pretty amazing. But you can't operate on that because it's too far in. You can't get to it. So this is another gliotoxin, is black here. And this patient had, these are really common, these little white spots. They're infarcts at the junction of the gray and white matter because that's where the vessels are smallest. And these are common in mole patients. But that looks like all this wrong there. So when you run this algorithm, she's got a lot more brain involvement than what you thought. But we have protocols that we can get a lot of that out of the brain, with oxygen, glutathione, and NAC, and some liver cleanse. Okay, so this is the posterior pituitary. Now, this is a patient that had surgery on the 12th, had pituitary surgery to take this tumor out. She had Cushing's disease. She was a yoga instructor and weighed about 120 pounds. when I saw her, she was close to 200 pounds. You know, and I thought it was dietary, but it was just cortisol levels were through the roof, and she had buffalo hump and everything. And so you see these 2 white spots in there. Well, the gliotoxin picked it up. This looks like gliotoxin in the pituitary gland, in the posterior pituitary gland, but she's got more stuff all over the place here. So we'll find out if this is going to have value later on. So the differential diagnosis here, 90% of the time, why don't I get better? Well, 90% of the time they're still in it. So you got to test all the, you know, surroundings and clothing and everything, figure out where it is and fix it. Or you don't get, it's no shortcut. You don't get better. And using the ionizer is really helpful. The one I showed you in the beginning. So you take a good history, do my old place, do tap tests on the patient. So when they come in, we take an open plate, tap the clothes with it, and then we see what the progress is. Are they still in mold? Yes or no? So if their clothes are full of fungus on the tap test, well, if it's in the clothes, it's in their nose. So that tells you they still got environmental contamination. And so frequently it's front loader washes. They all are full of fungus. You can't have those. And so the top loader, the Speed Queen TC5 model is the best one to get now. All these things, you can't get the fungus out of them. Some of the BMW models have this. They don't have a vent in the coil box to get rid of the water. Not all of them, but some of them. And some of them have they have a drain gutter that drains the roof of the car, but it's got a small outlet. If that gets full of trash, the water goes in the car door panel, and the whole car gets black inside. So they already know about all this. But then animals, if you tap dogs and cats, they're too numerous to count. That's normal for them. So you have a little protocol for them. They can't be in the bed. Try to keep them out of the bedroom. And then, so the reaction, remember, is 9,000 times normal systemic inflammation. So they got to have 0 to 2 or 0 to 4, depends on how sick they are, or all the treatment fails. And so you got to get the mycotoxins out of the mucosa if medical treatment doesn't help them. So you got to get them off of sugar. It's got to be a candida diet. It's got to be strict. So if they have a sugar receptor on a cell wall of the candida. So when sugar hits it, it changes into invasive hypoform, and that form is resistant to all antifungals. So if they're eating off the diet, you're not going to be able to kill it with anything. So they have to be on the diet for the drugs to work. So, and then you got to address the pituitary next. So these two, the air, the food, the pituitary, and the depressed immune system. So they could have Epstein-Barr, cytomegalovirus, any of these things, or heavy metals, almost all these people that have mold illness have got MTHFR. They can't methylate B12 and they can't dump the toxins. And then the rare one is cancer. I've only, in my whole career, I've probably seen maybe 6 patients who had cancer, you know, as a cause of why they were sick. But the cancer probably resulted from the mycotoxin, but who knows? So here's a summary: clean air, diet, and get mold off the table by tap test. Do high concentration. If the concentrations are high in the mucosa, you got to remove it endoscopically and evaluate the pituitary. And you got to know how to lower the air and the contents. And you do this with fogging, laundry additive, and have a filtration. And we add the ionizer here. Those are the things you can do that are very helpful. And then you go to saline nose washes. And citral drops are a combination of 4 citrus seed oils. You put that in the saline, and that kills fungus, virus, and bacteria and removes toxins. So wash out the nose twice a day with that, and then use amphotericin nebulization twice a day. And then we do gut health, liver function, immune system, viruses, limes, molds, heavy metal, you know, complete the workup for anything that make them sick. And then know these are the most common reasons for treatment failure. So this is the treatment protocol we use. We have some of this on sinusitis wellness. We take a evaluation form before they come in, and then we score them, and so we know how sick they are. You got to get in a safe place, take no belongings with you, and remediate the place and get those filters and ionizers and those things to lower the count in the air that you're breathing. It all enters through the nose to the highest concentrations in nasal mucosa. So we get a CT scan of your mycotoxin levels, and if they got any fungal masses, you got to clean them out endoscopically. This is several different ways to do saline. You can just do a nasopure squirt bottle or a Navage machine or a Grossman irrigator. All those are fine. You can't use tap water. You got to use distilled water or bottled water. And then the antifungal nasal sprays, we use amphotericin or voriconazole or Sporanox, and we get them mixed up by this pharmacy because you can't get them in a regular drugstore. We use oxygen at 8 to 10 liters a minute for 2 hours a day, and titrate if they have negative symptoms. Well, we used to use these tanks and liquid oxygen because it lasts longer, but now they don't cover it. So we get them to do an oxygen concentrator, and we do a liver detox. These are the things we use in a liver, either this or this, or there's a pill called liver detox that you can use. Glutathione and NAC, we use both of those. You can nebulize or take a pill. And Intramax, I like Intramax, the unsweetened one, because it's got 143 items in it. It's a vitamin complex. It's bound to carbon. So the vitamin goes intracellularly, drags the carbon with it, and the carbon takes the toxin out of the cell. So that's why I like that. It works pretty well. So this is a summary. And this, all these patients have GERD. So we treat the GERD as you need to, and we get them worked up for mechanical causes to fix if they need it. D3, we need it up in the 90s range. You got to heal the gut. Everybody knows how to do that. And we get food testing and interogram. This is IgG antibodies that a cow has, and it's also SBI is the same thing. So we give that to patients to control the gut, improper flora in the gut, and then use all the VSL, the probiotics. Then we can test pituitary axis here. That's important. And then the binders. I don't really use a lot of binders, so I'm not against them, but this is what we use if we use anything. Or charcoal is fine. Cholestyramine, personally, I never used it before, but people like it and have a good result with it. A lot of times I just don't need it. And then a yeast diet. And we start them on diflucan and nystatin, and then we switch them to, after we get rid of it, we switch them to a Sporanox or one of those to get rid of the rest of the fungus. And these are out. This is Sinus 5 is actually the product site for environmental products and body treatment products. And this is the educational site, sinusitiswellness.com, that we have. And this just shows you some of the filters. And this is a candle that removes all the mycotoxins in 3 hours. And this is you put this in a fogger and put water in it, and it goes about 30 feet. You can fog everything. You can fog your whole house in 5 or 10 minutes, with an extension cord. This is the fogger. We'll show you this next. So this is what it looks like. So we fog the new patients. We tap test them and fog them. After about 3,000 of these, I got sensitive to it. So I have to, we tell them to shower and do their clothes before they come in. And some of them get in, they're still full of fungus. So we fog them and put a gown on them and a hat. And I do the same thing. And then I put 100% oxygen on myself if we detect a problem with them. Otherwise, I can't even be in the room. This is what. So you don't just leave it on the floor. You just walk around with it and mist everything. But it's very effective. It knocks the counts down to almost zero. And this is what, I don't I rarely have to do this now because we teach them what to do before they come in. But if I have a problem with one of them, I have to do this or I can't even see them. Okay, this is we got with videos and all that stuff. So we have an environmental treatment protocol. And well, do we have any, this is the main thing. Do we have any questions now?
There's a couple things in the chat.
Okay, let's see.
Okay.
Let me see if I can get that. I can go this one.
Some question about glutathione.
This will be about
Okay, let's see.
And
8
promoting
this week
some toxicity.
Okay, let's see if I can find it.
Gliotoxin.
on this show.
Okay, now let's see.
Now.
Where do we I can see all of y'all. Now where's I'm missing the chat view.
Down at the bottom where it says share screen, and then right to the left of it, it says chat.
Let's see.
I can read it to you.
I've got something going on here. I don't, let's see.
So what we have is this is from Anna Fishbein. The glutathione was shown to promote toxicity in cellist patients. That's what it says, affected by mycotoxin, gliotoxin. Patients that were positive for gliotoxin antibodies should not use glutathione, and she would like a comment on that.
Patients who were positive, for which antibodies?
For gliotoxin.
Should not use what?
Glutathione.
I don't know anything about that. So, I mean, what's the negative about using it? What is it supposed to do?
Apparently there was some paper maybe 10 years ago, so that increases the toxicity of gliotoxin. I'm just reading, I don't know anything. I'm just reading what's written here. So
I have no clue. I don't know anything about it. So,
okay. I'm pretty sure you answered this, but what test do you use for mold? Do you use urine or serum?
I use both. We do IgG antibodies in the serum.
Mm-hmm.
And we then do the urine mycotoxins, and we do a tap test in the office when they sit in the chair. Tap test just shows us what their load is where they live. And so we do those three things. You don't really have to do all of them. I think the essential ones are a tap test on the clothes and the urine mycotoxin levels, because if the mycotoxin levels are high, usually IgG will be high, but not necessarily, because there are two separate genes involved. Mycotoxins are really sort of like the MTHFR problem, you know. They can't excrete the toxin. That's a totally different gene set than the sinusitis gene, where you react 9,000 times normal. They're not related. You can have both of them or any combination of them. So you could have one of the tests, for example, you could have the serum test high because they've got the allergy to the fungus, you know, the 9,000 time reaction. Mm-hmm. And that could be normal, but you could still have high mycotoxins because they can't excrete them. So probably best to do both of them.
Okay. Could you elaborate on the TAP test? You know, I heard you talk about it last week, but what exactly is it?
What you do is you take an SD-agar mold plate, you remove the cap from it, and you hold the media side down. So you want to tap the clothes and drive the clothing material into the media by tapping the clothes. So you tap in 3 or 4 times in each location, you know, chest, legs, back, you know, all over. Mm-hmm. And then you cap it and you send it to immunolytics, and they actually do those for free because they're going to get the environmental stuff and they make the money on that. So they actually used to do those for free. So that way you get it back in a couple of weeks, and you know, does this patient have a good environment? Yes or no? So you know for sure what's going on.
We get these agar plates from immunolytics, is that it?
You can get them for that, or you can get them online at sinus5.com.
Okay.
or immunolytics, or the pharmacy in our building has them. And they come in a box. And if you want I think you should use the lab test and not for office purposes. You should not count them yourself, because it's much more valuable for the patient to see actually a lab report showing what the organisms are, what the counts level are safe, and then that's more official for them. When they see that, about half of them will get active and do something about it. And you know, what's so strange about this is I think probably half of these people who are really sick will do something environmentally. And it's for a whole variety of reasons. But if you ask them, if your house is full of lice and you got thousands per square inch floor, wall, ceiling, bedding, in the drawers, in the sink, how many months are you staying there until you get another place? Well, they're all gone the same day because they can see it. But they're not, and that lice won't kill you, just make you itch, you know? And so, but they'll stay into something that can be fatal because they can't see it. And they can't stay with their lice paradigm. They just can't do it. They switch back to fungus, and it makes them unable to do anything. So the hardest thing is getting people to actually get involved environmentally. And if they don't do that, nothing I do is going to help them. So we try to screen them up front and get them busy doing things and see who's going to be cooperative and who's not before I see them.
I can actually, I had a patient today who came in and we did her test. We tested her October 27th. She finally showed up today. We called her. I said, it's positive. You know, we got to do something about this. Well, it's Thanksgiving. It's New Year. I said, how long have you been? I've been sick 10 years and it just didn't want to do anything about it. And she came in today. She's apologizing to me. I said, don't apologize to me. Apologize to yourself.
Yeah.
I'm just a messenger.
I don't know. You know, when I talk to them about lice and everything, they all have the same reaction. They're going to get out right away, but they can't stay with that. And right. So you can't really help them. So that's why these ionizers and all this stuff is coming in to try to get a massive amount of stuff in there just to get the air okay, so they can at least start to get better until you can either fix it properly or get out of it. Then if they got a front loader washer, they're never going to get better because they're wearing it 24/7 and they're sleeping in it. You know, so.
Okay, next question. Can uncompensated vestibular neuritis be connected to mycotoxins? What kind of test would you suggest?
Uncomplicated vestibular neuritis?
Uncompensated vestibular neuritis.
Yeah, you can get deafness, and any kind of vestibular issue can be due to mycotoxins and fungal exposure. So you want to do the treatment's the same. You do the same thing for all of them. Some of them might need surgery. Probably half of them need surgery, half of them don't. And you got to do the whole protocol, starting with the air, and to know if it's going to help them. But you got to tell them, look, if you want to really get rid of this, instead of masking it with pills, you got to mask it with stuff like Valium and, you know, the stuff like Ativan, those kind of drugs. That'll stop them from being dizzy, but then they are gorked out and they can't really function. So, and then they get hooked on that stuff and instead of really fixing the problem. So, if they will fix, you know, do the test, fix the air, have them get out of there and just go to the beach or something, go where the air is good and they feel better. Most of them know when they feel better pretty quickly, and stay there and see if your vestibular function doesn't get better. That's how you know, do a test quickly. But trying to stay in it and do your vestibular exercises is not going to work. And of course, they need to get worked up. All those people need a MRI with gadolinium to rule out acoustic neuroma or any kind of tumor. Just to get that off the table on the front end if they've had it a while.
And we've already had a lecture on gadolinium toxicity also, by the way.
Yeah. Well, they got something better now.
Not that I know of. What are your thoughts on?
Yeah, you can't really see it.
Right. What are your thoughts on colloidal silver nasal irrigation?
I like it. Irrigation's fine. It works pretty well. It's kind of broad spectrum, but you know, silver doesn't get fungus as well. It gets bacteria really well, but not as good with fungus. So what I like to use is the Citra Drops, which is or Citra Drops or SSKI, which is, you know, supersaturated potassium iodide. But you got to be very lenient with that. About 5 drops in 8 ounces is enough. You can overdo it. And usually that works. So those two things that I just said kill everything. I use silver more for bacteria, and you can nebulize it too. You know, through the nose or through the mouth, or take a teaspoonful. So it's a really good drug, but I don't think it's great for fungus.
Mm-hmm. How to prevent CPAP humidifier fungal growth?
Well, they make all these units that you put them in and sterilize them overnight. That's one way. Now, you know, they have these humidification devices that fill with water. What I would say to do is take the reservoir where the water goes and put 1 or 2 drops of Citra Drops in there. That you can find those on that Sinus 5 website. Mm-hmm. And don't put more than that. More is not better. But that'll stop anything from growing in that water or the tubing. But you still have to clean it daily. You know, you can't, you know, not clean it for a week. Everybody will get sick from those things if you don't clean them again, or get the unit that is supposed to clean it. You know, you just put everything in there, and I think it heats it up. And they have all kinds of ways to do it, but you can't have one of those and not clean it every day.
Got a number of great talks and great info, and thank you for being here. Someone else says they've already profiled patients that they think of that fit the profile. Any soap in particular to clean clothes with?
Yeah. Well, what we do, you use your regular laundry additive that you want to use. That won't get the mold. But on that Sinus 5 page, there's these products called EC3. And we made these products 10 years ago, maybe 12 years ago. And it's four citrus oils. And then you put, it tells you on the bottle how to use it. But the first time we use about 1/4 of a bottle in the tub with the detergent. And you get the things, you know, going, you know, rotating. And then you just turn it off and tell your phone to alarm in an hour. So you soak them in there for an hour, and then you finish the load. Then from then on, just follow the bottle instructions. You just put a small amount in your water, and that usually does it. It's EC3 laundry additive. It really works pretty well.
The question again is, what again is the problem with the front loading washers?
The water doesn't get out between the drum and the drain where you can't see. The water doesn't get out, and then that rubber grommet that seals it, behind that, it's all black pretty quickly. So that you can't get those things mold free. And I had a patient who was a professional washing machine mechanic. That's what he did for a living. And his was like that. And so he says, Doc, I can clean this thing. So he takes it out in the front yard, just assembles the whole thing, and has a commercial industrial strength steam cleaner, pressure washer, you know, steam. Mm-hmm. Washes it so it looks like it came out of the box, puts it back together, and the whole thing's back in a month. In other words, it's an internal drainage defect that you can't manage. It's too much volume in there. That's why the front loaders are bad. You're fighting uphill all the time, and it's better to dump it and get the Speed Queen TC5. That's the best one.
Okay. When you say no sugar, do you mean no sucrose?
Yeah.
And I'm sure all of the artificial sugars aren't.
Yeah, we don't want any. We don't want them wanting sugar. We want them off of it altogether, so they don't. You know, after a few weeks, you don't crave it anymore. So that's the best thing. If you don't do the diet, and you got the air clean, you're still going to be sick.
Right. I know. We use a lot of apple cider vinegar to get them off of sugar. That seems to be a
well, that's good. Yeah, that's good stuff.
Right. And I tell my patients it's the Judge Judy deal. It's a yes or a no. Not a little bit, not I had a, I'm 90%. That doesn't count. It's a yes or a no.
That's right.
Okay.
But I think probably only half the people can do that or will do that. The main thing, if you can get them out of the airborne fungus and get them feeling better, a lot of times the diet will get better. Mm-hmm. So, well, these videos you saw, these are life-changing videos. And this is just a small volume of what you can do. And the ones the sickest ones, like the girl that was blind, the guy in a wheelchair, I operate on the guy in a wheelchair, but the girl I never operated on. I just gave her medicine in the protocol, and she was good. Now, she didn't have any money in she had two brothers that were contractor type guys. So they got they got a used Airstream, stripped it down to metal, and redid the whole inside, with a stove, a shower, whatever you need to live. She moved into that, and that's when she came back with her vision coming back. She didn't take anything with her. Mm-hmm. It's interesting that the animals got the same symptoms she did, but they died,
Is a nasal culture accurate enough to start antifungal spray treatment?
Okay, so that's a good question. You don't really need to culture the nose for fungus. The clothes, I think, are more important because if it's on their clothes, it's in their nose. And you can do it by history. We start everybody that's coming in for a mole illness on amphotericin or voriconazole, nebulization or spray, depending on how sick they are. And there's just no problem with those. You don't have a problem. Some people can't take one or the other and switch to the other one, but it's not like you're changing the flora, the bacterial flora. I think if you got a bacteria in there, you can use silver, or we start them on something like Rosefin as a spray or a nebulization if they got a lot of pus in there. But some of them need to be irrigated out in the office. Put a needle in the sinus and irrigate it out, and then put the antibiotic directly into the sinus, and then you get a good result. Any other question about that? Culture, there's nothing wrong with a culture. It's just that if they're coming to you and they're full of mold, getting a mold culture is not going to change what you're doing unless they never get better and they got some kind of oddball thing, then culture it. Right. But that's pretty rare. I haven't seen any mold in the last 40 years that doesn't respond to either amphotericin or voriconazole that I've come across.
Okay. Lots of thank you for sharing about your products. And what botanicals might you recommend instead of using the azoles?
I like there's one called Candida Red that we have. We don't make that, but we sell it. Anyway, it's got 4 herbals in it. The typical, oregano, clove. So cinnamon, clove, and thyme in that order or antifungal. The strongest antifungal is cinnamon, then clove, then thyme. But oregano, and there's about 3 others that are really good for fungus. You probably know what they are. What are the common ones you use?
We use tea tree oil. I think we use.
Yeah, tea tree oil is like the nuclear option.
Yeah.
So, yeah, that works, but you can't use a lot of that orally.
Something like I can't think off the top of my something candlate something with a CAND. So somebody out there help me.
Let me see.
I use the biocidin protocol a lot.
Okay, what's in that?
It's herbal botanicals, a couple things, Chinese medicine herbs, tea tree oil. I actually have them put 2 drops in the neti pot of their liposomal cleanse, and they'll actually put it through the sinus for a sinus rinse. Helps clear out those bacterial biofilms.
Now, remember what we said about biofilms, right?
Well, it's not an antibiotic per se. It's more like an herbal.
Well, there's nothing wrong with what you're doing, but if you don't, and if you use oregano, you're killing fungus. But how did it get in the nose? It came in through the air, right? So
Right.
if you're treating them with that and you get the air fixed, you got a long-term solution. But as soon as they stop using it, if the air's bad, they're sick again. Is the point? So you got to really get. I call the treatment of the patient is more like the details in the weeds. The big picture treatment upstream is the air. You get long-term results if you get the air right. Then just about anything you do works.
Yep.
And then as soon as you get off the sprays, if the air's bad, they're sick again in a week or less.
Caprylic acid.
Yeah, that's fine. That's good. And also the garlic is really good. Caprylic acid and garlic and oregano. Those 3 are really good. And you can rotate them or use them together.
Right. That's and then there was a Chinese herb we used to use a long time ago. I don't know if it's still around, called phylostatin.
Yeah.
Okay. It was came from a Chinese herb company. We used to use that quite often also.
You know, if you get the right herbal combination, it's really effective. It works pretty well.
Okay. There was a question about the your website again. So I know sinus5.com was one. What was the other one?
Sinusitis Wellness. The Sinusitis Wellness is the educational one with the articles on it. It's not a sales one.
Right.
And the store is really sinus5.com. We named it that because it's easy to remember. The company's name is Microbalance Health Products, but that's too long to remember that. Sinus5 just takes you right to the store, and then you can see what you want to get.
And Steve Hartman says Biocidin liposomal solution, 2 drops in neti pot, rinse twice weekly for biofilms. Twice weekly, one for 1 week for biofilms.
Yeah, twice daily for 1 week at least.
Okay, got it. Okay, I don't know if you're familiar with those, Dr. Dennis.
Yeah, Biocidin is fine. It does. It's a good thing. You just remember for long-term results, when you tap those clothes on those patients, they need to be 0 to 4, or they're going to relapse every time.
Mm-hmm.
Because if you're putting 3,000 gallons of bad air in there, it doesn't matter if you're using Biocidin twice a day. You know, It's not going to work.
Well, here's a question. I don't know if there's a good answer to it. Please ask how to choose a healthy place. How do you know?
That's a really good question. Okay. There's a number of people who can tell when they walk in a place whether the air is good for them or not. You know, they can tell it's got fresh, clean air in here. I tell them, if you don't know, it's no. And if you go in there, it feels like really clean air, then you look further. Then you do plate counts and everything. But if you go in, the air feels kind of thick, stale, thick, or there's odors in there, that's a no. So it takes a lot less time if you do it like that. The other thing you can do when you go and you feel like the place has good air, then you do your tap test all around the house and all the rooms with different plates. And that's how you come up with what the counts are. And then if you really get sophisticated, you can there's devices that do particle counts at 0.3 microns. See what the particle count is. You're not going to go in a place where the particle count's 50,000. That's not going to happen. It's going to be 200 or 1,000 or even 1,000,000 in some of these houses. So if you go in, if you're sick and you get a newer house and it's fine, you feel good there, you're going to have to do several things to the house. You're going to have to remove all the fiberglass, put like an April Air 5000 filter in the central, and put a central dehumidifier in, just about, and get all the exposed fiberglass out of there. You're going to have to do that in any place you go if you're a sick person. And then that's the cheapest thing to do. So that you got to pick the right place first. And if you don't know, it's no. It's only if you're certain the air's good in here for me, I feel better in here. That's your first criteria. Now, there are some people who can't tell. Some people can't tell for a week or two whether they're okay or not. And in those situations, if they have a family member or a friend who's come more like a bird dog, it saves a lot of time. Otherwise, you got to go in there and in the places that you like, you got a mold plate. So don't get a crawl space. Don't do that. And don't get an old place. Try to get something that's between 1 and 5 or 8 years old. And it's on higher ground than the surrounding ground. It doesn't have any downward drainage on it, and it's not around trees. In other words, you got clear sky all around. You don't have trees hanging over the house. That's the first criteria. If you walk in and they got candles blowing everywhere, walk out, that means they're trying to hide something. And if they got some kind of odor in there, just leave. It's not going to be a good place. So it's a screening process of what's the first impression when you open the door and walk in. Most people have some impression if the air is clean or not, or if it's heavy or stale, or you don't know. Usually in a clean air place, you know. That's the first criteria. But that's why you get the particle counter, because those who can't tell can use the particle counter as a way to tell, what the real particle load is in there. Those can be expensive, but it's probably worth having one.
Like a canary in a coal mine.
Pardon me?
Like a canary in a coal mine.
That's right. So 20% of the population is like that.
Mm-hmm.
And if they don't get a good environment, you virtually can't ever get them better. And a lot of them empty their wallet on medical treatment, and they didn't know it was their environment. And so then they don't have any money to fix the real problem, and they got to move. There's people living on the desert in tents, in groups.
Are there areas of the country that are worse than others? I'm sure there are.
Well, yeah, the South, the deep South, where like New Orleans, for example, those kind of places. Generally, you just want a place where you can get away from the trees, and you got clear sky, and you're on higher ground than the surrounding ground. And do you feel good outside there? Or is something outside bother you? Generally, the best places to live on the ocean or in the desert or in the higher mountains, above the tree line. Those are usually good places, but you can find a bad place anywhere. You just got to get sophisticated about looking. So if you go in a place and you think the air is good, then you look at, the heating and air unit, and look at the plenum, which is that big box that sits on top of it where the ducts come in. If the plenum is metal, you see metal on the outside, that means it's insulated with fiberglass on the inside. So that all has to come out if you're going to buy the place. And that's common. And so also ductboard, which is lined with fiberglass, is common. So remember, fiberglass is cotton candy for fungus. And so you're going to have a massive fungal problem and a lung problem if you get fiberglass.
Okay, Dr. Wyndham says she just moved from Laguna Beach and living on the beach was very high risk of mold in homes due to high constant humidity. I lived the South Jersey shore for a while, and it was the same thing. I mean, the metal on the car would flake off within a year. We had to paint the windowsills, every year. And anything that was either metal or even wood had to be repainted every year. It's high humidity all year round there. Especially right on the ocean there, at least in South Jersey, and I see here Laguna Beach also. So
okay, so that's a good point. So the outside atmosphere is really good for you, like if you're near the beach. But the problem is, if you're going to live on the beach, you've got to have central dehumidification on the unit with the warm, the dry air blowing onto the coil. And if you maintain that, and your humidity inside is 50 or between 40 and 50 all the time, you're good. But if you don't have that, you really can't. You're going to have a bad problem. So you on a beach site, you can get a bad house or a good house, but you're in control of what happens in that house. Now, if you go in and the house is already bad, I wouldn't fool with it because you can empty your wallet pretty quick. So you want to find one you're good in there and it tests low on mold, and then you deal with that one. That's the easiest thing to do. So mold plate counts are really important because it tells you right away if you got a real problem there, even if you can't detect it. It's worth spending a little extra time being thoughtful about what you're looking at, and don't settle for anything but a place that the air is good and you feel better in there. That's to start with. And you don't have chemicals in the air and all that. You're going to spend much less money fixing that place than you would a place that you feel is a little bad and you don't feel quite good there, because you can dump $100 grand really quick in a house like that, just trying to get the air right.
Is there any, if there's any, with real estate transactions, is there any requirement for any this type of testing? There's radon and there's lead and there's things like that. Or
some of the states they got a disclosure, like if you have mold in your house, you got to disclose it in a sale. They got that in Georgia. I don't know about other states, but it really ought to be so you have mold requirements to sell a house. What the counts have to be. Now, if you take all the mold testing that's typically done, Hermes and Hertzheim, all those tests, they're really good tests, but the number that they consider okay for humans is way too high. So you can spend a lot of money on that test and think that it's okay, and it's not. So you got to drop that number way down for these patients like I see. And the number is going to have to be closer to that 50,000 at 0.3 microns that I told you. That's the particle count, but the mold count on those tests, they do PCR tests in the burden. So on a PCR test like Hermes or the Hertzheim test, it's got to be 0. That's the best number for that one. So just take whatever they consider to be normal, and it's got to be way lower than that.
The CAT is just a statement. Nevada has no inspection for mold nor legal protection if there is mold. Dr. Dell asks, and I could probably answer this one: does carpeting harbor mold?
Yeah, carpet's not negotiable. It has to go.
Right. So, and so our just to go back to the growth hormone. So in our practice, our IGF-1, our goal is usually about 200 to 250. So, I see somebody at 123, which you say is average. That's not average for us. That's low. So just aside.
Well, you're right. But remember that one that had 283 that was
right.
growth hormone deficient. So you're right. That's a good number that you picked. But it's not what's really happening with growth hormone. But it's as close as you're going to get.
Right. So, again, there's growth hormone stimulating tests. There's one called Mycotoxin, which is an oral test now. There's the insulin ones, of course. But most of my students actually know what growth hormone deficiencies are. Not most of the world, but pretty much a lot of the folks on here would actually know what it is because, we test it on everybody. That's part of our routine. So.
Yeah, you're way ahead of the curve. You're ahead of the endocrinologist because if that number is normal, they're not getting tested.
Yeah, we're so way ahead of them; they don't want to hear from us. So
now they know some stuff that's really important, but they don't get growth hormone at all, and they leave the thyroid too low. These patients need thyroid about mid-range. The free T3 needs to be about 3.5 to 4.2 in these people, unless they got a heart problem, they can't tolerate it. So you're more antifungal if your thyroid's mid-range. If it's lower, you're more a host for fungus.
Mm-hmm. Okay. Question for, there's a statement about endocrinologists in the chat. You can look at it. I'm not going to repeat.
Okay, so I can't. For some reason, I've got.
It's questioning their management of the endocrine system, their skills. So we'll just leave it at that. So.
Well, you know,
I think the AOA is still following me around, guys. So I have to watch what I say. Anything I say shows up in their report. So I'm not gonna repeat that one. It's okay. Anybody else have any questions or comments? John, are you still here? You've been quiet tonight.
Yeah, I am here, and I'm just admiring all the good info being exchanged. It's appreciated.
This is my sidekick here, Dr. Dennis. So Dr.
Oh, yeah, you told me he was gone. Now you've got, you're blurred at the top of your screen, John.
Yeah, I don't know why.
There you go. You got it.
All right. Hey, and while you're talking, I've been messaging with friends here. One who is just building a house and completing house in Roatan to try to get low fungus, and faced on a hill facing the windward side. So we'll see if that works. And others who are looking at other islands right now, trying to decide where in the hell do you go if you have a sinus problem, because it's life-threatening otherwise.
Now, they're doing the right stuff. If you get in the right environment, you're going to be good. But they need to get a CT scan of their sinuses and make sure they don't have some physical obstruction in there. It can be a polyp or something like that, so they literally can't drain. And so you want to get that off the table if it's a chronic sinusitis problem. Generally, if somebody has chronic sinusitis and they haven't had surgery, they need to be evaluated, because if you open all the sinuses endoscopically, you can then irrigate all 8 sinuses out yourself every day. It can't get loculated in there and cause infection. And so that's a really big gain for long-term chronic management of sinusitis, is to have your sinuses open so that you can access them to both nebulize and irrigate, and then you can totally get rid of chronic sinusitis by doing that treatment. If your air is okay. So if you get your air okay and you got your sinuses open, you're running, then you're going to be fine. You can manage it. But if they're all closed, you know, the orifice is only like 2 to 3 millimeters in diameter, and some less than a millimeter. And so a little edema, you're done. That sinus is blocked, and then you go get infected. So you make generous openings in all 8 of them, and you can access them with your irrigator and put whatever you want to in there, and it can't grow, you know. So that's a safer way to, if you have the problem, really chronic sinusitis is hurting you, you're infected all the time. That means 93% of the time, that means you are in fungus, or you have fungus in your sinuses, even if you're out of it. So you're going to be right 93% of the time if you say that.
Excellent.
Yeah.
Okay. Anybody else have any comments, questions? Dr. Wyndham, you have anything you'd like to share with the group here? So.
I don't think so. It's my first meeting with everybody.
Okay, well,
I do use
welcome.
a lot, but thank you. I do also use a lot of biocidin and I think it's Kirkman Labs, Yeast Aid, and Biofilm Defense. I tend to like those two. Just
okay, I got a quiz question for you. Deanna?
Yeah.
I got a quiz question for you.
Okay.
How do you not have to use so much biocidin?
How do I not have to?
Yeah, how would you not have to use that much?
by using more antifungals, I suppose. I do use also a lot of, as you do, diflucan and ketoconazole.
Yeah, all that's correct, but go back to the air.
Oh, air. Sorry.
Get the air right, and you massively cut your medicine down. It's massive. So, and these people come in.
The first thing we do.
I know all of you have people that come into your office with a bag full of 50 bottles.
Oh, yeah.
And they're taking some of all that stuff. And the only thing wrong with them is they live in a house that's full of mold. If you get the house right, you throw the bag away most of the time. You know.
Hey, Dr. Dennis, what was the name of, I know it's Air Oasis, but what was the other company besides Air Oasis? There was one more company you named?
Well, the one I like the best is called Ultimatum. And you go to ultimatumusa.com and go down where it says the units. You know, it'll show the first unit they show you is it looks like a little fan. It's about 18 inches wide or so, and it looks like a fan. That's the one you want. It's like $1,400, you know. But that's the one that's called needle point ionization. So that doesn't create any ozone or hydroxyl group that you can detect or smell. And that's putting out like 350 million particles per second. So it fills up a 20 by 40 by 8 foot room in 2 minutes with bipolar ions. So that's going to remove mold, mycotoxins, bacteria, viruses, and VOCs. It removes all that stuff. So, but not contents. It won't treat the contents, just the air. But that air is what they're breathing. And so if you get the air right with 2 or 3 of these things, a lot of the times they'll massively get better until they can either fix the house or dump it, you know, and go somewhere else. That's the one I like the best because it's offensive instead of defensive, but it's got a HEPA filter on the back of it. So it acts as a HEPA as well. But the main thing is the bipolar ions without any chemicals in it. And so now I had an experience with that. I don't believe any of this stuff till I try it myself. And so I got the first time we got this Christmas tree that, you know, the fake one. And it came in a box and they dump it outside in the rain. And, and, you know, they slow down the truck and kick it out. And then, so it's got plastic around it, but I think they store those places in unair conditioning places. It must have been 102 where it was. Anyway, it had this strong smell of cardboard and everything else. It smelled really toxic. I couldn't be in the room with the tree without 100% oxygen. You know, so I got these 2 things that do a 20 by 40 foot room. I put 2 of them right on the tree. And the next day, I couldn't smell anything in that tree if I stuck my nose in it. It was zero. It was gone. So that's VOCs. So the VOC, if it gets VOCs, it gets everything else. So that's why I liked it. And I've had, so like somebody's painting a room or something, put them in there, it's gone, you know.
How important is water filtration in your opinion?
It's really important. You got to get chlorine out of the water. I got one on my shower. I don't think a whole house makes any sense. You don't want to you don't want to take the chlorine out of the john, you know. So I like the, you know, to do a proper filter that'll get the chlorine out of the water is the main thing. Now for drinking water, I'm pretty antsy. What I do is get Mountain Valley spring water in glass bottles, and that's what I drink. So I think spring water is the best choice. Glass is the best choice, wherever you can find that. Now filtered water works, but when you drink filtered water, like reverse osmosis or something like that, that's good water. But then you drink for like a week, Mountain Valley spring water or a good spring water. You won't drink the other stuff anymore. You'll be done. You know, it's just so much better. Nobody's touched it. It came out of the ground. It's what you're supposed to drink, right?
You know, I asked you in the last class with the stem cell people, chlorine dioxide's gotten a real huge movement, and it looks like it cleans the blood and it adds oxygen to the blood. Have you heard of any of that movement, or are you working at it?
Yeah, but I'm cautious about that, but because the chlorine part, you know, chlorine does not kill fungus at all. So copper does kill it, but chlorine doesn't do much for it. So it overgrows, you get overgrowth of fungus and yeast in your body with that, unless it's got some special property that it does kill fungus. But I'm ignorant, I got to tell you, about that subject. Okay. I haven't tried it before.
Okay. All righty. So I think we should let you go. Almost about time to let you go, huh, Dr. Dennis? We've
well, whatever. You know, I'll take whatever questions you want.
Almost 2 hours here. So anybody else have any comments or questions? Okay. And we got a lot of thank yous, a lot of great information. Thank you so much. Hopefully, we try to have our follow-ups in 4 to 6 months. Hopefully, you'll be amenable to coming back at some time in the future. And you're more than welcome to join us. We're here every Tuesday night. We had a little snafu in our scheduling, so next week we have Dr. Campbell. So, but he'll give us a little something in the specialty range. So I know he does some stuff with I think either autism also. So it just so happened to work out that way. We were supposed to have Dr. O'Neill Smith this week, but she had to drop out. And remember, spread the word. February 21st, we have Peter McCullough on. And love him or hate him, he's quite controversial and quite outspoken.
What does he do?
Peter McCullough is sort of the lead. He's a cardiologist at Baylor, and he's testified in front of Congress about the vaccines and the safety in all of the COVID therapies. That's what he does. He's got to the point where he's being canceled quite often. And he was at our conference. He has got 80,000 followers on Instagram. He was at our conference last March, and he's just type his name in, Peter McCullough, any search engine, you'll find he's quite prolific. He's all over the place. So.
I think it was toward the end of that pandemic. I think he was getting a little bit aggressive. I think the only thing left off is you have to get your daily booster in order to get your food card to buy food.
Right.
That's about where it was at by the time they quit. But they're still recommending it for small children or 6-month-old babies and stuff. They're just insane.
Yeah, I know. I agree. So so he's been on here a couple of times for us on Tuesday nights. We had our last conference was last March in Las Vegas. He was there. And we got death threats. So he's quite the guy. So
I would like to say that he's only deserving of love. He's a phenomenon, and if we want to describe him quickly, I think we would say he's the #1 cardiovascular/COVID expert on the earth. He's really, truly amazing. And he's led by fact, science, and research, which makes him easy to deal with.
So, yeah. So February 21st, please spread the word and bring your friends, bring your colleagues, bring your dog, bring your enemies.
What's his first name again?
Peter.
Okay.
Peter McCullough. I think if you type his name in, you'll get 40 million hits, I think, on a search engine. So
I don't get out much. I have to study up about him. That's good.
Okay.
That'll be a fun one.
Yeah, he's quite entertaining. Next week we have Dr. Campbell, and then we have Dr. O'Neill Smith. You know, she's one of our immunologists. I have Dr. Benoit Tano coming up, and Dr. Neustadt's going to be coming back also. So that's coming up in the next couple of weeks. John and I will be talking. We're going to see if we can. I'm coming out of it, so we're going to see if we're going to get together for a live or in-person thing, maybe in the middle or the end of the summer. So, and oh, by the way, tomorrow night, if you're ever on Dr. Farshian's webinar, it's sort of the sister one to this tomorrow night. Let me know because I'm speaking. So, I'm going to be doing just an introduction to bioidentical hormones for them. That's what they wanted. So, and I think they're asking me to come to their conference in Miami in June. So, and Dr. Farshian he's the American Academy of Stem Cell Physicians. It's the one you did last week, Dr. Dennis.
Yeah.
Yeah.
So,
yeah, I want to listen to him.
So, so that's coming up. And a couple of us were going to be at AMMG at the end of April 26th for their age management medical group. Have you ever been to that group, Dr. Dennis?
No, I haven't.
They're like Avis to A4M. So they're or the AOA to the AMA. They're like, the next group down. They're a good group. They're fun to be with. They're not quite as stodgy and a little bit less sorry, I got a message here. And a little less, formal, I guess. The question is, so when I get the video done, it usually takes, I can either get it done tonight or this one's kind of long. I probably won't get it to our web person until tomorrow. All of our videos, all of our information is at aosrd.org/webinars for the videos for these webinars, and usually have a transcript with it. The conferences that we've had is aosrd.org/events. If anybody wants anything, wants that, we've been doing this for about 2.5 years now. We have quite a extensive library of integrative medical.
So it's AOSRV, is that right?
AOSRD.org. Yes, .org. I put it in the chat there. AOSRD.org, and then the /webinars are where all the videos are. I probably won't get this to our web lady till tomorrow, so it'll be by Thursday. It'll be up. So, so we have that. Like I said, tomorrow night is Dr. Farshian's. If you're interested, let me know. It's the American Academy of Stem Cell Physicians, and I'll get you the link to that. So just get in touch with me. Don't know how to get to me. Dr. Bill 9 at gmail. That's me. Dr. Dennis, of course, is at sinus5.com, and your other one was
Sinusitis Wellness.
Sinusitis Wellness. There's my memories going. My break-needle levels are low. Sinusitiswellness.com.
Right.
Wellness.com. Okay, that's Dr. Dennis's educational website. Sinus5.com for his products. And we can't thank you enough. It was very informative. And I know it was kind of a last minute type thing. So we really appreciate it. And again, what I tell everybody, bring one friend, we will double our audience in a week. Just one friend.
Yeah. Well, I like listening to other people, that do stuff that I don't do. I'm not interested in everything.
Mm-hmm.
So, especially hormones.
That's the best. I would have been driving an Uber if I hadn't found hormones. So I hated being a doctor.
Hormones and stem cells, I think, is where it is.
Yeah, I always say that. I always tell everybody I'd be driving an Uber now if I hadn't found hormones. So I hated being a doctor. That was the worst. So I don't know if John would have let me out of it though. So that's so. Okay, everybody.
Okay.
I thank you all so much. And one more question. I usually put vinegar in my wash to combat the Lyme. Does that help with the mold?
Yeah, to some extent. I think vinegar is okay. If you added the citra drops to it, or even SSKI drops, which is potassium iodide, you would kill more fungus.
Okay, there you go. And dryer heat?
Dryer, what? Dry?
What about dryer heat? Is there anything you can add to put in the dryer to?
That's a good question. I think probably you take the EC3 spray and spray a dryer down if you've got a front loader really good, and see if you can, and then run it a few times, and then see when you pat in there if your clothes grow things on a mold plate. If you do and you're changing out your front loader, you got to change the dryer too. Sometimes the heat of the dryer will kill it all.
Got it.
Hey, Doc, I just wanted to mention Dr. Stephanie Sanoff. She talks about corn petrol gas that's loaded with the glyphosate. It looks like they're doing some testing, and they're finding out that while you're driving, there's a lot of glyphosate in the air. In-cabin air filters. Have you ever dealt with some of the in-cabin air filters, or know of some companies who have, high-powered air cabin in filters for the vehicle because a lot of us are driving and we're in that traffic for a long time?
They are in-cabin filters. I don't know the names of the companies, but Wine, I think it maybe WEIN maybe have one. That's a kind of a good idea. Now remember, so where does this stuff come from? What's the name of the chemical you're talking about?
Talking about Roundup, glyphosate. It's in the corn.
The
ethanol that's put in the gas.
Okay. So they think that it's getting inside the car?
They think it's getting in the air. So when your gas, 10 to 15% of gas is ethanol.
I got you. I understand what you're saying now.
Okay.
All right. Yeah. Okay. So they think that the fumes from the cars that are driving around are coming in your car, and you're getting glyphosate.
Yes.
All right. Well, the best thing to do is to find, if somebody's got a needle point ionizer that's for a car, it's small, that would be a great market, because you could recirculate the car in a minute multiple times with a small fan. Like a 6-inch fan or an 8-inch fan with those things in it would be all you needed.
Right.
I don't know if the company makes that. I can give you the guy's name is Tony. Let me see. The owner, he's an Italian guy. Let's see. Okay, this guy's name is Tony, Milanese. Tony Milanese, like mayonnaise. And I'm going to give you his mobile number, and I never gave it to you. You know how I got it, 518-669-8997. And his email is almjr@acleansystem.com. The letter A, cleansystem.com. He's the one that makes the ultimatum filter. And the office number is 800-247-1020. he makes these big systems for fire trucks and all that stuff. But he has the technology that if he felt like there was a market there, he could make this in a car. You want to have the ions turn over so they fill the space as soon as they're gone. So it's always in the air. It's 100% times in the air. So I don't know if he's got anything like that, but the room unit that I was just talking about, it runs on low voltage. It would, something smaller than that would be perfect. So that's all I know about it. But I'm wondering, you know, there's got to be less glyphosate in the air than everything else in the air. So maybe ventilation is the best answer, you know, and then there's a doctor that has there's things that plugs the holes that glyphosate does in your intestinal wall. You know who that guy is. He's got a lot of products that you drink and it has really no taste. It plugs the holes in your gut from glyphosate. Have you heard of that stuff? No.
Are you talking about Dr. Zach Bush?
Yeah.
Okay. Yeah. He's pretty intense. Okay. Thank you.
Zach Bush has got the products he uses will get rid of the damage that glyphosate causes in your body.
Right. Exactly.
And so that's probably the answer.
Agreed. Wow. Thank you very much.
What is the name of that? It's a liquid that you take a capful once a day. I got some in the refrigerator. I forgot the name of it.
Got me.
Well, just look up his name, Zach Bush. You'll find it. He's good. He's a smart guy. He does a good job.
Agree. Well, him and Dr. Sanoff.
Yeah.
We can get her on the.
So that's what I did. Look him up and get it's a liquid product that you take a capful a day, and that fixes the glyphosate damage.
Right. Boom. Will do. Thank you so much, Doc.
Thank you so much. Yes, thank you. Okay, everybody. I think it's after 10 o'clock on the East Coast. I think it's time to let Dr. Dennis at least take his tie off. Relax a little bit.
I thought I needed a tie. I didn't know it was all. It was.
Oh no, we're in Nevada here. We're all informal here. So.
Yeah. So next time I won't have the tie on.
Yeah. So it's okay. Yeah. No, I wore a tie every day when I lived in Pennsylvania. I was seeing patients in Pennsylvania, not here. So. Yeah. So. All right, everybody.
And my wife was born on the Eastern Shore down there.
Yeah. We're Maryland. So.
I mean, in New Jersey. She was born in New Jersey.
Okay. So yeah. So I lived in Margate for a while, which is 3 towns down from Atlantic City.
That's where she was born.
Yeah.
Margate.
Margate.
Parents,
yeah. Well, actually, it was on 36th Street. It was the first street over from Margate in Longport. That's where all the quote unquote rich people lived. So we were only one street over, but there were no public schools in Longport. So the taxes were half of what they were on the next block over. So anyway, thank you again. Please, don't be a stranger. And we'll see you again next week, everybody, same time, same station. And if anybody has any questions, comments, let me know. Like I said, February 21st, Dr. Peter McCullough is coming. Next week, we have Dr. Campbell, and we continue on. Okay, John, any final word?
All good, thanks.
Okay, again, Dr. Dennis, thank you so much.
Thanks for the
and I will
opportunity.
be on tomorrow night on at 5 o'clock my time, 8 o'clock Eastern on the American Academy of Stem Cell Physicians. Shoot me a message if you want. I'll get you the link. I don't have it right off the top of my head.
Yeah, just go ahead and shoot it to me. I like to go on that.
Okay. Well, it's the same one that you were on last week.
Okay, good. I can find it.
Okay.
All right. Thank you very much. Good night, everyone.
Thank you, everybody. Good night. Good night. Come home soon, Joe.